Welcome to the Boulder Rotary Club, which, despite the snow and the COVID-19 virus, is still the place to be on a Friday afternoon in Boulder County. In the 101 years that our club has been meeting, this is the first time we have met electronically. Although we would prefer to meet in a place where we are physically together, where we can shake hands, where we can clap hands. Meeting in this fashion does not diminish us. Let me remind you, it does not diminish us in our spiritual bond. It does not diminish who we are. It does not diminish our relevance to the community. Let me remind you why we remain relevant. 6 weeks ago, we raised over $35,000 at our annual signature event to connect members of the Oglala Sioux tribe in Pine Ridge, South Dakota, to clean drinking water. 1 week ago, I received an email from past President Rod Tengi stating that our club raised $5,880 for the Imagination Library to help more young kids learn to read. And as we meet here today, we are in the process of sending $6,000 to the Jerusalem Rotary Club to help fund a Preserve Planet Earth project to recycle used computers and electronics in an area of the West Bank where the Palestinian people currently burn these electronics to extract the metal so that they can have money to buy food and other necessities. So while the arrival of a new virus in our community may change how we meet, it does not change who we are. And I would remind you that all Rotarians know a little something about battling viruses. Now, as far as I have a few quick announcements before we get to the program. First, our Boulder Rotaract Club is still selling fudge to support the Honor Flight program. Fudge and chocolate are still comfort foods, which in these times are needed. So if you want to buy some fudge and support the Honor Flight and Rotaract, you can email me and I will make sure you get plugged into your fudge. As far as future meetings, many of you know the CDPHE, Colorado Department of Public Health and Environment, issued a public order effective yesterday that prohibits meetings of 10 or more civic-minded people like us for the next 30 days. As a result, we won't be able to meet at the JCC through at least April 17th, 2020. And I also wanted to let you know that our next Board of Directors meeting continues to be on March 23rd, and that we intend to address the issue of how to adjust our member dues as a result of the COVID-19 outbreak. Now, I'm going to turn the computer screen over to past President Mike Brady, who is a co-moderator with Carl Kurtz, so he can introduce our speakers today and give us a little tutoring on the Zoom medium. Take it away, Mike.
All right, great. Thank you, John. So like anything new, there's a learning curve, and I want to talk today about Zoom. For those new to video conferencing and Zoom, the more we use the service, the easier it will be, and you'll have a better experience. Now, we're hoping this will keep our culture of connectedness and caring for one another, even if we're in various locations. Everyone is muted while I walk through some Zoom basics and throughout the meeting. Now is not the time for troubleshooting or asking questions. If you're having trouble, you'll have to do the best that you can for today and then communicate with Fred Hall or Gary Kahn after the meeting. Now, that being said, the fact that you can hear me means that you've successfully logged in to your computer or called in through one of the phone numbers. So congratulations. For the full experience, we highly recommend that you turn on your video, look through the computer as we share visuals in the future. Now, at the very bottom of your screen, you should see a bar with some controls on it. The bottom left is the most important, as that has controls for your microphone and video. You can mute or unmute yourself, but for today's meeting, everyone is starting out in mute mode. There is nothing more irritating than having a large group in a video conference. Someone has their mic on while eating potato chips. So as co-hosts behind the scenes, Fred and I will monitor the participants and have additional remote control of turning your mic on or off. We highly encourage you to click on the video button right next to the microphone in the bottom left so we can see you. If you're having trouble with the video or audio being jerky, that may mean you're using too much bandwidth at your home, and you can solve that by turning off your video. In the middle of the bottom bar is something called chat next to a speech bubble. If you click on that, a side panel should come up and you can chat to everyone or an individual person. As we go through today's meeting, you may think of a question for our Q&A section. Type the questions into the chat section and moderator Carl will address them. If you can't figure out the chat function, you can email them to me at mike@generositywealth.com, mike@generositywealth.com, and I'll get them to Carl. So you type your question into the chat section and then he will review them and ask our panelists, or you can email them, mike@generositywealth.com. At the top of your screen are different views for your fellow participants. The top right-hand side, gallery and speaker view are the most common, and I recommend speaker view. There are a lot of us on this video conference, so if you can't see everyone, you just scroll down or maximize the screen and then scroll down. So that's it for today. Once again, the more we use this, the better we'll all be at this particular medium. So let me hand the mic over to our moderator and program chair, Carl Kurtz. Carl?
Thanks, Mike, and good afternoon, everyone. Welcome to our program, The Brave New World of COVID-19. Aldous Huxley's Brave New World, published in 1932, is a dystopian novel depicting a future world in which everyone has been scientifically engineered to fit into a distasteful social hierarchy. Dystopian is the opposite of utopian. Rather than showing the world at its ideal best through the author's eyes and values, a dystopian novel portrays society at its worst. In these days of the coronavirus pandemic, with its geometrically increasing infection and death rates, quarantines, voluntary or enforced social distancing, hoarding of goods by frightened citizens, rampant unemployment, and markets in disarray, it seems like we are living in our own brave new world, not a fictional one. It's the opposite of our values and a world that none of us wants. Our goal today is to bring together our Rotary community online to share information that will help us better understand, prepare for, and cope with the impacts of this worldwide scourge on our state and local communities, and to learn more about how Colorado and Boulder County governments are coping with it. We will seek rays of hope and optimism and ways to work through this difficult time as a club and a community. Because we want the program to address the concerns that are most on your minds, the bulk of the program will be devoted to your questions and answers from a panel of knowledgeable members of the club. So let me just check at this point. Susan Motika, are you online here? Gary, do we know anything about Susan's status?
She was on. I'm just kind of quickly looking for her so I can unmute. Unmute her. There she is. No. There's so many of us. There we go. Susan, are you on?
Yes, I am on.
All right, great. Thanks. Go away. Go.
So, Susan, this is Carl Kurtz, and I was just starting to introduce you. And Fred, if you can put up the short bio slide we have. So we're beginning with a presentation by Susan Motika, Director of Strategic Initiatives for Boulder County Public Health. As you can see on this slide, She is an attorney with an extensive background in community-based work on social justice issues. For the last 10 years, she's worked in the field of public health. Susan will bring us up to date on the status of COVID-19 in Boulder County and the efforts by Boulder County Health to combat this scary new disease. As you can imagine, Susan and her colleagues are swamped with work. We are incredibly grateful to you, Susan, for sparing a few minutes to speak with us today, and we will respect and honor your need to keep your participation brief and to drop off of our video conference at the conclusion of your remarks. Susan, welcome to Boulder Rotary Club. We look forward to your remarks.
Thank you, Carl. It is an honor to be here, and I'm sorry that Jeff Zayak, our public health director, could not be here. I've been in communication with Gary Kahn on and off throughout the last week, and I think I've explained to him, as Carl indicated, that we are on the response more than 12 hours a day, and I have done my best to put together some talking points. I'm not on video right now. I'm using my screen for my talking points to update you on some of the most current developments, including some from the governor's press conference just about an hour ago. You know, what our case count is, some of the latest guidance from the National Institute of Health, some mental health tips, and finally, how you can volunteer. I also sent Gary, and Gary, were you planning to show this, the state of Colorado public health order summaries? It's fine if it's not.
We weren't able to get that.
Yeah, I've sent it to you, so I can reference that briefly. Okay, great.
We share that in our newsletter with the rest of the folks.
That sounds great. Okay, so a website which I can send to Gary, but I want to have you reference it all, is covid19.colorado.gov/data. And again, I'll send this to Gary. But this website can give you an up-to-date count of what is happening in Colorado in terms of COVID cases. Many of us keep it on our website who are working on the response, of course, all the time. But as of today, as of this morning, out of 277 cases have tested positive out of 2,952 people tested so far. So what this rough math indicates is that only 10% of the people being tested get COVID. So we have to remind ourselves that people are getting other respiratory illnesses that are typical to this season. Presently, we have 19 confirmed cases of COVID-19 in Boulder County. And I would say, even though I just praised the state website, that they are a little bit behind because there's still pieces of manual entering that they need to do. Our epidemiologists are doing investigations on the positive cases. And what that means is that they are speaking to people who have had contact with people who are testing positive and speaking to those people, their families, their networks. And what I can confirm right now for you is that we do have community spread in Boulder County. We have community spread in various places in Colorado at the present time. I know that there have been a lot of questions about the masks and the equipment, and I was just on a very important call yesterday with the law enforcement community in Boulder County, and they were really pressing on this because, as you might understand, there's so many places, in addition to hospitals, fire responders, police, EMTs, our long-term care community that are in really serious need of PPE. So we're trying to get a count from the national stockpile on equipment that will be released. We don't have that number right now, but we are expecting equipment from the federal national stockpile through the Pentagon. The other thing that I've heard factually is that there are some manufacturing challenges with the equipment. Much of this equipment or A percentage of this equipment has been manufactured in China. Obviously, they have some slowdowns. So really looking at everything the state can do to support manufacturing, supporting the use of the Pentagon stockpile. That's what I know right now. I would also say that Governor Polis in his press conference, and I have sent the latest orders and guidance from the state of Colorado to you all that you can have on your website or in your newsletter. But the current press conference, the governor started at around 11 o'clock today, dealt with a series of economic orders. The orders I've previously sent you have been dealing with public health issues and social distancing. Today's address by the governor dealt very strongly on economic relief. What can be done for businesses? I know this is important to you. The fact that the tax filing deadline will be extended. The fact that there would be a foreclosure and eviction hiatus, to provide relief to homeowners and renters. So there will be a series of economic measures that are going to happen through this executive order. I will get that likely from the state if it's not already in my inbox very shortly, and I will just forward that to Gary. And what I can keep doing is forwarding you the latest public information from the state as soon practically as I get it. So I wanted to address, let me look at my time here. And this was something Jeff Zack sent me this morning, our public health director, and this is going to be from the National Institute of Health. And this is a very latest study on the importance of social distancing. You know that the governor did an order saying we should not be congregating in groups of higher than 10. It should be 10 or less. So here's why. A latest study that Jeff just gave me this morning. So many people have wondered if we couldn't simply protect ourselves by avoiding people with symptoms of respiratory illness. Unfortunately, the answer is no. A new study shows that simply avoiding symptomatic people will not go far enough to curb the COVID-19 pandemic. That's because researchers have discovered that many individuals can carry the coronavirus without showing any of the typical symptoms of COVID-19, fever, dry cough, and shortness of breath. But these asymptomatic or only mildly ill individuals can still shed virus and infect others. This conclusion adds further weight to the recent guidance from the US public health experts. What we need right now most to slow the stealthy spread of this coronavirus is full implementation of social distancing. So what does this mean? Well, for starters, it's recommended that people stay home as much as possible, going out only for critical needs like groceries, medicines, or to exercise and enjoy the outdoors. Some of these measures that you've heard about may sound extreme, but this study by the NIH-funded researchers just published in Science documents why social distancing may be our best hope. So here are some very quick facts on this. For every confirmed case of COVID-19, there are likely another 5 to 10 people with undetected infections. Although they are thought to be only half as infectious as individuals with confirmed COVID-19, individuals with undetected infections were so prevalent in China that they apparently were the infection source for 86% of confirmed cases. And after China established the travel restrictions and social distancing, the spread of COVID-19 slowed considerably. So I can share that with Gary, and I've got a link to this article, which I'm happy to send him as well. But I think that the orders, the summary of orders, which I had the county attorney do for us, you can look at those at your convenience. But again, bringing us back to Colorado, that's the amended notice of public health orders closing bars, restaurants, theaters, gymnasiums, casinos, and non-essential personal service facilities, and racetrack and off-track wagering facilities statewide. And then the social distancing order is another one and then the executive order ordering the suspension of public and private elementary and secondary schools. So those, I had the county attorney summarize those. I forwarded those to Gary. If you don't want to wade through the depth and the length of the executive orders, you can rely on that county attorney summary from Boulder County. So I want to address another topic that is extremely important, and we may want to think about a way to provide some ongoing updates to Rotary as we are developing toolkits and things that are readily transmittable to the public through these online methods. And by the way, that was the best description I've ever had of Zoom. So thank you very much. Nobody ever trained me on that. Thank you very much.
You're welcome.
It was awesome. So I want to turn to the issue of mental health. And in the short order, while we are compiling mental health resources in a way that can be, like I said, electronically transmitted, I would urge you to go on the Mental Health Colorado website and to direct people to that, because I think we not only have the obvious health concerns, we not only have the obvious business concerns and economic conditions, but we also have mental health issues. So the director of Mental Health Colorado urged us to think about these tips, and they are on the Mental Health Colorado website. I'm just going to reference them briefly, but one is to take care of ourselves, and that's sleep, exercise, good nutrition, connecting with family members, to be limiting as appropriate our social media news, because it can be very overwhelming, it can be incorrect, and this can cause a lot of anxiety and fear in people. And the third tip he had was share in positivity, meaning random acts of kindness, 3 good things to remember at the end of a day, a gratitude letter, and he cites that positive psychology interventions that our brains are working better, keener, faster when we're in a positive mode than if we're in a negative or fearful or neutral mode. Of course, one that won't be a surprise is practice mindfulness. And there's a number of apps that are really readily available, Insight Timer, Headspace, or Calm, to do short meditation. But the feedback that we're getting is that even stopping for 5 minutes at a time, 5 minutes a day even, is beneficial to our mental health. Practicing and having compassion, kindness, and patience. It's a very difficult time where, for example, in my job, being aware of our incident command structure, chain of command, who does what, just think about some of the things that we're going through, trying to do our very best to model respectful, compassionate, patient behavior, is going to be very, very important. So I want to close with volunteer opportunities. We are presently seeking volunteer clinicians to assist with our response to COVID-19. And if you are interested, we would ask you to visit www.bouldercounty.mrc, M as in Mary, R as in race, C as in cat, bouldercountymrc.org, and fill out an application. We will have continuing, ongoing, increasing need for medical professionals. So please consider that seriously. And if you are not a clinician but are interested in volunteering, and you may have already given this link out, www.helpcoloradonow.com. Okay, so that concludes what I had planned for today. I just look at my time for a minute. I think that I can be answering some of these questions. I have a couple more minutes to look at those questions. Would that be useful?
So Susan,
Yeah.
this is Carl. Thank you so much.
Yeah.
Yeah, I think maybe rather than going to those questions, we've had a few questions coming in already that you might be able to address. For our Rotary Club members, it wouldn't be a Rotary meeting if John Kotke didn't ask the first question.
Okay, now I'm scared, Carl. This is what I said to Gary, that so many of these questions are so technical, and that what I find is that Jeff Zayak will tell me, hey, in a half hour, the advice changes. So it's just like it's moving so fast from both a government and medical perspective, as you might imagine. Okay, well, I will try a couple, and I had told Gary that it makes sense for you all to collect these and get them to me, and then we can answer them, okay? But I'll try a couple right now because I just have a few more minutes. Go ahead.
So our first question from John Kotke is actually a medical one, but I suspect you can answer it, and perhaps Gary can assist with it. If one gets the virus and recovers from it, can you still be a carrier?
Well, I think what I've heard, and I'm going to be very careful here because I have a JD, not an MD, but what I have heard, and I just heard this yesterday on a call we did with law enforcement, one of the serious parts of this disease is that you don't develop an immunity that you can get the virus a second time. And we saw that in China. So the issue, people need to have active symptoms as a carrier, or as I described in that NIH study, you know, they are people who are having the disease but not manifesting strong symptoms. I'm just not sure. I'm pretty sure, but I want to be very careful that if you've had it and fully recovered, you're not a carrier, but you could be susceptible to getting it again.
Gary, anything you want to add?
I think that's correct. I think once you've recovered, especially fully recovered, you're not likely to be able to be transmitting the virus anymore. But I would say for anybody who is really got that question, you need to check the current information and check with your provider if it's critical for your situation at the time that this comes up. Hopefully, the thing that will change dramatically in the next few weeks is that we'll get much broader testing, and everybody will be able to have a lot better information about who and who isn't carrying the virus because they can be tested to make sure they're not, for example.
Okay, thank you, Gary and Susan. So Jim Rudowski has a question, and we're going to suggest that Jim go ahead and ask that himself. So Mike is unmuting him, right, Mike?
Yes, when I see him, and if you can unmute yourself, Jim, otherwise, there we go, Jim Radowski, unmute. There we go, Jim, you're on.
Okay, well, I've got a mouthful of sandwich, but I'll do my best. I've heard that so many providers are out of masks and gloves and other equipment, but I've also heard that there are somewhat over 500 hospitalizations total that have occurred from the virus. So how can all these hospitals be out of such basic equipment, some of which they should have on hand, if there have been so few hospitalizations?
Jonathan, I think you should feel free to come in if you have answers. I certainly don't have an answer to that.
I think that we don't have an exact precise count from all the hospitals. And I think that in addition to people who are inpatient, there's a tremendous amount of screening going on. And remember, people are using protective equipment for, you know, a range of infectious diseases that are happening at the same time. So I know that hospitals are suffering shortages It is serious. That's all I can say right now. I don't have the exact numbers of their bed count.
Daryl,
And those are changing all the time as well.
Daryl, do you want to comment?
Yeah, I just think a description of, how PPE, personal protective equipment is used in a hospital, I think, or even in the physician's office and screening centers and everything else is, you may go through, if you've got somebody that's a positive patient, I mean, you could be going through, 20 sets of PPE daily. And obviously hospitals are trying to limit that. We're using masks and things like that fall within the current guidelines are helping. But it may not be associated with the volume of admissions in terms of what the current burn rate is of existing PPE.
And this is Jonathan Singer. I'm just going to hop in real quickly. And so I was just on a conference call with our federal congressional delegation last night. Just as a quick update, all the hospitals in every district are facing PPE shortages right now. I have two colleagues, one who's a nurse, the other who is a MD family physician. The FDA and HHS departments federally are working to break those log jams, and frankly, there wasn't much of a stockpile before, federally speaking. Interestingly enough, I'll just add one more thing. The Hospital Association is working with outdoor equipment manufacturers to actually create those masks because there's a lot of folks, fortunately, in the outdoor industry here in Colorado who are looking to shift their production lines to things that are dealing with life and safety right now, sort of like we shifted our manufacturing during World War II to the war effort. They're doing the same thing right now. And so it is a real issue, and definitely with stockpiling and hoarding that was done, there is definitely an issue there. And I'll just say lastly, we're looking at price gouging that's happening right now, not just towards individuals, but frankly towards hospitals as well. And unfortunately, Colorado is one of over a dozen states that doesn't have specific price gouging laws that prevent price gouging. So literally, I'm texting with other legislators on the Judiciary Committee right now and the Attorney General's office to see what can be done within the governor's emergency powers to put a halt to that price gouging instead of waiting for our federal prosecutors to hop on that.
Thank you. Susan, I want to check in with you on your time. Are you still good with staying on?
No, actually, I have to jump on another call at 1:15 that I need to get ready for just a little bit. I want to thank you all so much in this panel, Daryl, Jonathan, others. Thank you. Jonathan, what about the Consumer Protection Act for the price gouging?
No, that's exactly where I was going with that, actually, is that we are looking at the Consumer Protection Act and using that as a tool. But interestingly enough, we don't have specific price gouging laws, but the CPA or Consumer Protection Act is what we're working with right now. Whether or not it provides adequate protection, only time will tell.
Wow, that's great. Well, thank you all so much. And Gary, feel free to collect questions and I'll be as responsive. Our office will be as responsive as we can be. Thank you all for your service and your dedication to our community.
Thank you.
Thank you, Susan, and blessings to you and your colleagues as you continue your vital work. And stay safe.
Thank you so much. Bye-bye.
So you've already heard from some of our panelists, but let me introduce our interactive portion of the program. We have three very knowledgeable members of our club online to answer your questions. They're Representative Jonathan Singer, a relatively new member of the club representing District 11 in Longmont in the Colorado House of Representatives since 2012. He's chair of the House Committee on Public Health Care and Human Services. Dr. Gary Kahn is a board certified physician in the fields of preventive and family medicine. He's involved in so many aspects of the club that he needs no further introduction. Today's program would not be taking place without Gary, as he has drawn on his remarkable range of resources and knowledge to put it together. Our club past president, Daryl Brown, is Assistant Vice President for Development at Boulder Community Health. He's also one of the masters of humor in our club, a quality that stands us in good stead in these times.
Not today, though.
We're asking you to submit your questions in writing through the Zoom chat as Mike instructed initially. Click on the chat button at the bottom center of the Zoom screen. You can direct your question to everyone or to any individual who is on the line. As a general practice, please send your question or comment to everyone. Even if you're not planning to ask a question, you might want to open the chat window so that you can see the flow of questions. With assistance from Mike Brady and Bill Anderson in the background, I'll be monitoring these questions, selecting some, grouping some, and occasionally asking people to ask their questions directly online. So our primary focus today is designed to be on the health and safety aspects of the coronavirus. We're considering a second video conference on the economic and budgetary impacts of the pandemic, but depending on the flow of questions, we may get into those aspects as well. Let's go to some questions that Bill Anderson had posed as part of our video conference management team dealing with testing capacities. Jonathan, I don't know the extent to which you can respond to this, but what is the state of Colorado's current testing capacity and how is it evolving? And how are the daily numbers of confirmed cases being collected and updated now that private labs are also testing?
It's a great question, and I'll do my best to give you an update. And if Daryl or anyone else has other answers, it is an evolving situation. First thing that I would say is first of all, if you're not feeling well, regardless of your insurance status, the governor has issued an executive order saying that all testing is to be free. Now, free doesn't mean a whole lot if there aren't tests available. And so the first steps really are to self-quarantine if you feel like you have the symptoms, and then reach out to your individual healthcare provider to get a recommendation from your physician so you can utilize our drive-through testing facilities. And I saw that Karen McCormick already posted the COVID-19 state website, which has a lot of FAQ responses on there. So thank you, Karen, for doing that. So, right now, testing has been it's been very small. It's been, close to about 60 tests per day. CU, Denver Health, or I should say CU Anschutz, Denver Health and Children's Hospital have now, just as of yesterday, said they will have what they need to process approximately 1,000 tests per day. So that is something that will be ramping up very quickly to about 1,000 tests per day. The real point of getting tested right now is really for public health purposes. So we can track where it's going, where COVID-19 is going, where the hotspots are, and how we can respond in a public health fashion. It's unfortunate one of my own colleagues, Michelson Janae from Commerce City, has a confirmed case right now. She's self-quarantining. She's doing all right. But the symptoms, there's no vaccine. So the symptoms for this are, in terms of treatment, are going to be very similar to other things that Gary can sort of expound on. But we're doing our best to ramp up to it. But I don't want to sell false hope here. We're still at a very low process, considering we have 5.5 million people in the state and can likely ramp up to about 1,000 tests per day.
Okay.
Right.
Daryl, any comment?
Yeah, let me go. I'm in on a local level here at Boulder Community Health. I mean, obviously, we're utilizing the precious test kits that we have for our most vulnerable patients. And so we're testing really hospital inpatients or patients that require admission to the hospital that are really sick. You mentioned that basically the situation is evolving. There's no question about that. I mean, we're going to have a testing capability coming online with private laboratories, but also hospital laboratories. And we're attempting to ramp that up here. And when that comes online, it's going to really help us in many ways. You pointed out the population health aspect there, John, and we can't stress that enough. And that's part of the difficulty right now is that, if you can't test people, you can't tell how the virus is traveling, what areas of the county that it's prevalent in. I do have an interesting statistic from this morning, and this is actually more updated than the COVID-19 site. For Boulder County, we're looking at 3.38 cases per 100,000 people. And if you look at Eagle County, and you guys know what happened up in the mountains there, they have 90 cases per 100,000 people, all right? And so that, to me, the ability to test is going to be imperative here, all right? And that'll really help us to, I think, get a better handle on it more quickly, respond in the areas that we're having kind of flare-ups. It almost seems like a little bit of a, I don't want to say minimize the situation, but Rotary has great experience with this, obviously, with our fight against polio. And that's how population health and epidemiologic responses happen. Gary can probably speak a lot better to that kind of situation, being a medical doctor.
Well, I just would like to add that in the directive this morning from the health department, state health department, they indicated that they're going to be allocating testing to areas that have not been tested before, so they can get a bead on what is going on out there, because a lot of these rural areas, for example, in Colorado, that have not had testing available at all, and don't have really very robust healthcare resources to respond if they get an outbreak or a cluster. We don't even know what's happening there, so they're going to be allocating a lot of the testing in that direction right now. One thing that I would say, because I think everybody might be interested in this, in a clinical update thing that I got last night, is what are the symptoms of COVID, and what percentage of people have these particular symptoms? So of course you've heard cough, and that's about 65 to 80% of people. Only 45% have a fever when they present with this. So that those screenings that you've seen with in the airports with checking people's temperatures, they could easily have COVID without having any temperature at all. But during the course of the illness, 85% will develop a fever, but there's still 15% that never get a fever. So shortness of breath varies between 20 and 40%. But that's an indication of a serious problem, and that's when you really need to be sure you're checking in with your provider if you have any of that. And interestingly, and you don't hear about this, but 10% of people that end up having the virus come in with GI complaints, nausea, vomiting, diarrhea, and unfortunately, that's not being taken into account, in my opinion, well enough. At this point, because those people are often shuttled into regular emergency departments and other things where they could be exposing people. So that's some information that may be of use.
Thank you. So Peter Ewing has a related question about the speediness of testing results. Peter, you want to jump in here?
Sure.
Mike is muting you.
Sure. I guess I've been unmuted. The statistics that were mentioned at first, that we'd done over 2,000, almost 3,000 tests, of which 277 were positive, but only 19 confirmed cases. Now, I understand that a presumed positive is potentially indicative, but then it has to be certified or double checked. And what is the holdup? Why are the 277 still presumed positive and not yet taken over to the confirmed cases category?
Who wants to take that one on?
That might be more Gary one, I would think.
Well, one of the, if I understood your question, Peter, one of the problems is that these PCR testing, they can have, that can take, days, and a lot of people are complaining because they're not getting their test results back even when they've been tested. So, and until, and there's also a fair number of false negatives, which is a problem too. So false negatives mean you're testing negative, but you actually may have the disease. And so unless you're tested again and show up as a positive the second time, you may not really know. So,
well, but these are potentially positive, and I think we should, from China, have an experience in terms of what percentage of the positives are false positives and false negatives. So, and why is it taking so
Oh, I got
long
on.
for them to be
It's quite
confirmed?
interesting. They're really getting into good stuff.
Oh, good.
one of the possibilities, Peter, is that the testing protocols that we've been using are different. I mean, what the CDC put out is different than the WHO test, for example.
Right.
And initially, the Chinese were not sharing their virus so that we could actually create the tests that we needed.
Mhm.
Yeah, so you know, some of those extrapolations are hard to make at this point. And I just make the other comment that a lot of this is currently evolving, and you know, nobody's got these kind of answers really solidly. But I would recommend that people listen when they're paying attention to somebody, to the NIH representative that comes on the cable news and stuff a lot. He is I think our best expert.
Yeah, Peter, what we're seeing is no less than a 72-hour report out time when we're doing testing. And we performed about 315 tests. 15 of those were positive, 100 were negative, and I got 200 results that are pending. All right. And as Gary pointed out, there are problems with the testing, and some of them they're basically saying, it's a voided sample, and it's really not a problem with the sample. It's a matter of how they're, splicing the RNA or whatever when they're doing their test. Okay. And the testing needs to be repeated, which of course then further drains resources.
Okay, let's switch gears a little bit and move off of the testing issue. Let me just preview a little bit. Our plan is to go to about 1 o'clock with this formally, and then John will close the meeting. But our panel is willing to stay on afterward to continue to answer your questions. But one of the beauties of a video conference is you can, unlike at the JCC, when everybody sees you get up and walk out early, you can just disappear whenever you're ready to disappear here. So Bill Anderson, let me go to you with some questions about social distancing.
Sure. So one question that I had, and Carl, I don't know if you're going directly from the list or not, but one question that I had is, how about food? I know that there's a lot of concern that people have about getting delivery food, going to the grocery store. Can you tell us anything about what risks we would face by going to the grocery store, by getting takeout from our favorite restaurants that we know are struggling right now?
I can hop in on the restaurant part real quick because it turns out carry-out food is cheaper than family therapy, so I've been doing a lot of it. The first thing that I guess I'll mention is that, and this is where Susan Motika would have been really helpful. Our restaurants are monitored by the Colorado and local, I should say, Boulder County Department of Public Health. And so arguably their kitchens are cleaner than, well, they are cleaner than my kitchen. We'll just put it that way. I won't talk about anyone else's kitchen. So, I would have a high degree of confidence in using our restaurants based on the fact that they are inspected by our departments of public health. And, I have to say, just having walked into a number of restaurants, it smells more like bleach than it ever has before. So I wouldn't feel uncomfortable. I would actually encourage you to go, if you can, tip heavily if you can afford to at this point. It's going to keep them afloat, and it is a very safe option.
And then just to follow up on that, unless others have a response, just more generally on societal restrictions, we see that orders have been issued in some places like California to shelter in place. I've heard rumors that are sort of unsubstantiated that Colorado is contemplating similar rules. Have you heard anything about that? And if so, is there any sense of a timeline on when that might apply?
So I'll answer, and then if anyone else has any other information, I will say that I'm maybe just a half beat or half step ahead of the media on many of these things, but a lot of times I'm just watching the press conferences like everybody else to get the information with everyone else. What I would say is my sense of it is that this governor right now is looking at the broader picture and to see whether a shelter in place would make sense, as opposed to using other best practices like social distancing. I think there is a reluctance to do it unless there's a huge outcry from our departments, State Department of Public Health and Environment. Interestingly enough, that Department of Public Health and Environment is run by someone with a master's in public health and a former county commissioner, I believe up in Eagle County, she actually has a PhD as well, Dr. Jill Hunsaker-Ryan. So my gut says that I don't feel like that is coming. My gut instinct is that you will see further restrictions on business. You may see local restrictions that may include some sort of shelter in place order, but coming down from the top, I'm not hearing that right now. I'm not getting a sense of that right now. And I'm talking to executive branch agencies every day and getting an update every single day in the afternoon. So I haven't heard it, but definitely, what I would say is they're going to follow the science on this one. And if the science really says that this is what we need to move to, you'll hear it very quickly without a lot of heads up, because it's about preserving public health and safety. I just don't get the sense that will be coming in the next 24, 48 hours unless significant conditions on the ground change.
So thank you for that. Let me point out, I hope all of you are monitoring the chats because people are not just asking questions. Dr. Mark Stern has added to some of the comments about test results. Charlotte Rome has posted something about San Miguel County. Take a look at those yourself on your screen and continue your learning that way. Let's jump to some questions about hospital capacity, both at a state level and Daryl here at Boulder Community. Can you say anything, Jonathan, about ICU capacity in Colorado and how well it's distributed across the state, and the number of ventilators we have and whether that's adequate or not?
Absolutely, I'll do my best because I'm actually waiting to hear back on those capacity components as well, actually. And so first of all, I'm going to jump to the ventilators right away because this is Rotary Club. And if people want to get in contact with me after this, I've put my email, I'll put my cell phone number up there as well. I actually, for those of you who live up in Longmont, if you're not familiar with the makerspace called Tinkermill, there are some engineers who have a little more free time on their hand, and they are actually in the process of creating, they actually just got their 501c3 and are working on a low-cost model to create ventilators if ventilators are needed and there's a shortage for our hospitals. So anyone who's familiar with angel investment or anything like that, if they want to get in touch with me, these guys are engineers, they're not business people, but they're making something that's easily scalable and will hopefully, and hopefully not when, but if the situation becomes dire, they would be able to ramp up not only here in Boulder County, but statewide and nationally. I'm still waiting to hear back on ICU capacity. I don't know if Daryl has some additional information on that, so I don't want to misstate anything on that component. But what I would say is that, Governor Cuomo has stated in the last couple of days that they're expecting the virus to peak in 45 days. So if they're a little ahead of the curve in terms of where they're at, I would say we're still pretty far out.
Yeah, I tend to agree with that too. Just a real quick thing on ventilators, and that's one of the problems is that they're not cheap to hospitals at this point. I know that everybody's looking at what could be a more cost-effective alternative, but a hospital ventilator can run upwards $50,000 to $75,000 right now, and so you don't have them lying around for every single hospital room. Boulder Community Health currently has 12 ICU beds. We're going to have the ability to quadruple that number. As far as ventilators, let's see, I've got that right here too, is that, where is that in my notes? Sorry. We've got 12 ventilators that are ventilators proper. Okay, again, so one for each one of the ICUs. We've got a couple portable units that aren't meant for longer term. We also have additional 20 anesthesia machines, which are basically breathing machines for while you're, getting anesthesia for surgery, but they can easily be used for that. And so I would imagine, proportionally, it's probably the same for every hospital. And if you look at, the ability to quadruple beds and ICUs, you're not going to be able to do that with ventilators. And so we're looking at some creative alternatives there in terms of, are people going to have to, operate ambu bags or something? These are planning worst case scenarios, okay? But if you look at, I guess, some of the experience that they're seeing in Italy, that has been a pinch point. And the question will be, are any of these other manufacturing and alternatives, are they going to be coming online soon enough to help with this crisis?
All right. Well, thank you to our three panelists. I know we're just scratching the surface of questions here, but I want to respect people's time as well. So let me turn it over to John Sullivan here for some closing segments of the program. And then, as I said earlier, we will stay online for anyone who wants to continue these questions afterward. So again, thank you all to Gary, Daryl, Jonathan, and Susan Motika.
Yes, I want to echo Carl's thanks. And I mentioned before that Rotarians know a little something about battling viruses, and that's because Rotary has been working with the World Health Organization and the Bill and Melinda Gates Foundation for over 30 years to eradicate the wild polio virus. And as a gesture of our thanks to you for taking the time to speak with us today, the Boulder Rotary Club will donate 100 doses of polio vaccine in your name and in your honor to this campaign to eradicate polio. Thank you again. And now for something completely different. George Russell has a little something he'd like to share with us. Over to you, George.
Okay. Can you hear me?
Yes.
Can't see.
Oh, well, let me do this.
That was better.
Okay.
There.
So it's a small birthday. Fred Hall's birthday is today. He's been a real contributor to our club, and I wanted to mention that first. And I don't know that Fred wants to say anything, but if he does, we'll listen. If not, I'd like to do this little poem I wrote. Our life is like a ribbon that we walk down every day, with laughter on the one side, the other side dismay. If you stray to the right side, you'll encounter laughter here. But if you travel to the left, the laughter turns to tears. Sometimes the road gets narrow, like walking a tightrope. Sometimes it's very wide, sometimes a slanting slope. I try to walk on the laughing side and keep it tilted that way. I don't walk in the middle except at the close of day. I sometimes overtake people who are on the other ledge, so I reach out from the other side and help them balance on the edge. I've fallen off the other side because of one thing or another, sometimes having tripped myself, sometimes dragged and pushed by others. But I've learned to stay on the laughing side, so when misfortune swings its stick, I duck and grab onto that laughing edge and I hold on like a tick. So I suggest you do the same. It's not so hard to do. It's easier to say ha ha than it is to say boo hoo. Now, this last verse is pathetic and should be stricken from the draft, but I'm not trying to be poetic. I'm just trying to make you laugh. I can believe you can find funny in everything you do. And if you spread it around, you'll cause a laugh anew. Laughter is a wonderful thing in this crazy world we live in. And what makes it so wonderful is that laughter keeps on giving. So put some laughter in your heart. A goofy smile on your face will do. Because I'm tired of laughing at myself. I want to laugh at you. Thank you very much.
Oh, thank you very much, George. And for those of you who are wearying of singing happy birthday twice while you're washing your hands, it's my understanding that you can sing the See You Fight song once and accomplish the same sanitation goal with your hands. I'm going to close, but not until I say thank you to some people who we couldn't have done this without them. Gary Kahn, Fred Hull, Mike Brady, Carl Kurtz, Bill Anderson, Cassidy Murphy, Marty Evans, Daryl Brown. Let's give them all a round of applause. Thank you. And I want everyone to stay healthy. Keep your sense of humor. Don't panic. And have a great weekend. Meeting adjourned. Stick around for questions if you want.
All right, thank you so much, John. If you click in if you're wanting to leave the meeting, click in the lower right on Leave Meeting. And those who want to stay on, we'll keep going here. I've got a couple of questions about volunteer opportunities. One is Margie Sullivan asked for the website. It was announced earlier. If somebody took that down and could post it on the chat, that would be great. Lynn Johnson, Mike, if you can unmute him, or Lynn, unmute yourself. You wanted to ask another question about volunteering.
Lynn Johnson's on.
Lynn's still on.
Hi.
Yeah.
Hi, Michael. Yeah, I wanted to ask, I deliver for Meals on Wheels, and on Monday, which is my day, I was required to sign a very detailed legal waiver statement, which I didn't understand. So I did sign it, I made my deliveries, but I have the basic question. Delivering and being the single contact on a given day with particularly seniors, am I assuming any liability, given that Meals on Wheels has denied any liability for the organization?
Can anyone answer that?
I'm not an attorney. I'd say, really the only way I could answer it is practice all the things that we've been talking about. So frequent hand hygiene, social distancing. So if you're leaving a meal, my suggestion is hand hygiene, or with gloves or something, you set the meal outdoors, you knock, you step back, the minimum distance, which is a pair of skis. I'm talking sticks, not these little teeny skis they use nowadays, and then allow the person, to grab their meal and everything at their own leisure, and while you're an adequate distance away. And then same thing with them. I would think that they would need to, practice hand hygiene and, really be practical. And that's the only way I could answer it. In terms of what liability is, I mean, you'd have to, I think we have a few attorneys in the room probably.
Yeah, I mean, Lynn, this is Bill. Other lawyers on the call may have different views of this, but from my perspective, as long as you're exercising reasonable diligence, one, obviously, if you've got a temperature or are symptomatic in any way, I would stop immediately and I would no longer take deliveries. But my suspicion is this is not an entirely resolved question, but there's kind of a good Samaritan element to what you're doing. I think as long as you're being careful, following general procedures about social distancing, I wouldn't hesitate to do that work as long as you feel comfortable about your own safety in doing it.
Okay. Daryl, did you want to add anything?
Oh, no, I'm sorry. I was just going to send a few chat things to everybody. And I actually do need to get going. So if it's possible, I'd like to just say a few things about local healthcare here in Boulder, okay? I mean, we do have lots of information on the BCH website. Certainly encourage everybody to use, you know, the obviously the CDC website, the CDPHE website, Boulder County and Boulder Community Health, okay? So we've modified our visitation policies, and we're not really allowing many visitors except with certain circumstances such as end of life, childbirth, and whatnot. Elective surgeries are canceled right at the moment, and that's a recommendation from CMS, the state, and obviously we're all playing in that arena now. Part of the thinking there is that we want to preserve all of the essential supplies for the needs that are going to be coming in, not just now, but in you know, next week and the week following. We're just seeing non-urgent visits at our clinics until the 27th, and we'll be reassessing at that time. Remember, the hospital is still open for acute injuries, heart attack, stroke, you know, all the things that you would traditionally go to the emergency room for, okay? And then if you do suspect COVID-19, we are encouraging you to not go to the emergency department, okay? The last thing you want to do is to, you know, really kind of lead to that conclusion. We may not be able to test you. BCH does have a nurse triage line, which I'll put on the chat here in a moment, 303-415-8180. It's also on our website. You should call that to see if, you know, what and be triaged to see what your action should be. Also getting with your primary care provider. We are going to be having more and more telemedicine visits, and I can assure you that we are prepared to handle this in our community. I think more so than a lot of places, not just within the state of Colorado, but within the nation. And part of that is because we've done a good job planning, and we've been on top of disaster preparedness. So with that said, I'm going to send out the nurse triage number, and then I actually need to get back over to our incident command, where we've got really our team of professionals working 24/7 on the issues that are going to come up. Do want to thank everybody involved with this. Boulder Rotary is an amazing thing. Also, I do believe that we're going to have a special place on our website here, which will give more information about this crisis and what we all might be able to do during it. So want to thank everybody for attending myself, and I am going to have to sign off in just a minute.
Thank you, Daryl. We know you're slammed as well, and best wishes to you in helping Boulder County Health manage this crisis.
Thank you all.
Let's see, John Sullivan, you had a question about prioritization of testing. It may be more of a Susan Motika question, but do you want to pose it?
That's kind of what I was thinking.
You want to pose it anyway, and we'll see if we get any responses?
Sure. The question is, I know of a 23-year-old male who is displaying all the symptoms of COVID-19. He is on oxygen. He's on an oxygenator because the breathing difficulties are so severe, but he can't get tested. And so the question is, how are the county health authorities or the public health authorities prioritizing the use of the limited number of tests that there are?
What I can tell you is I also know somebody who has a pneumonia and all the symptoms that tested positive for influenza A. But because she is not ready for hospitalization, she can't get tested. So I think the threshold in Boulder County right now, as of at least yesterday, was if you're not a candidate, if you're sick and you're not a candidate for hospitalization, you're going to be told to shelter in place and isolate yourself, and you're not going to get tested. That's as of, hopefully that'll change soon.
Hey, and this is Jonathan over here for those of you who are listening in but not videoing in. The only thing I can add on the priority testing right now, and I know it's frustrating and it's very scary to not know. I have two friends who are very sick who are exhibiting symptoms right now, and are well connected, not just because they know me, but other folks, and still are not able to get tested. In terms of screening right now, priority testing right now are for healthcare workers and emergency service workers, because they are the ones that really have been in contact with the most vulnerable populations. The testing purposes right now are really primarily to look at the populational health issues as opposed to individual treatment. If you're exhibiting symptoms of COVID-19, you could also be exhibiting symptoms of other viruses, even other coronaviruses. And the treatment is going to be very similar. There is no vaccine. So if you have significant enough health symptoms, get in there, get treated, and you're going to get treated very similarly, whether it's COVID-19 or even another coronavirus type. As more tests become available and we ramp up to those 1,000 tests per day, that'll hopefully alleviate itself, but it's a scary time. I won't sugarcoat it, but really we got to prioritize this to people who are in contact with vulnerable populations and serving those vulnerable populations to make sure that we're not spreading this further.
Thank you.
Thank you.
I noticed, by the way, I didn't track this completely, but at one point we had at least 80 people online. We still have 45 who are still on. Bill Anderson prepared a lot of questions in advance, so I'm going to ask him maybe to kind of clean up on some of those here. And so Bill.
Yeah, and to the extent that you all can answer them, that's great. If you can't, we totally understand. Listening to what's happening in New Rochelle, for example, there seems to be a higher degree of federal, state, and local coordination there than perhaps anywhere else right now, at least as I'm seeing the news unfold. I'm wondering, given the substantial amount of military that we have in the state of Colorado, has there been discussion of involving the National Guard or active duty military in the process, and perhaps even using facilities that they already have if and when the hospitals should be overwhelmed by patients?
I'll jump in on this one again. It's Jonathan here. So National Guard can be deployed. The Army Corps of Engineers are the ones that are responsible for building new things or fixing things, to use the technical terms there. The National Guard is out there to provide logistical support and also have teams who can do tests. As far as unfortunately, my most recent update is from March 16th, so I'm a couple days behind right now. They have been deployed in Telluride and in Gunnison. I'm sure they're in other counties right now that are most heavily affected. I know that both El Paso County and Pueblo County are coordinating, because they are likely to be the ones hardest hit in terms of the medical outbreak and needing the most sort of medical intervention due to just lack of resources right now. Not so much in terms of, a priority hotspot in terms of the epidemiological component to it. So anything beyond National Guard is really up to our federal administration. And I know, our governor is talking with Congress and the president almost daily on those as the situations evolve. But people, once again, can reach out to me, repsinger@gmail.com, if they've got more questions on that one.
And on the other side of that, in addition to sort of the manpower that would come with using the National Guard, are there plans that are being built right now for overflow if the hospitals are overwhelmed? And I know in some places California was buying old motels and looking at using those. Are we looking at using dorms or other facilities to house overflow patients if and when we get to that point? Or are we not necessarily making plans for that at this point in some hope that it won't be needed?
What I can say, and I can get more clarification later, is the Office of Emergency Management with the state is looking at that right now. We are fortunate in the sense that we do have several military bases here in Colorado. And so we do have a little bit more infrastructure to be able to build up things a little bit faster. Not just down in Colorado Springs, but even as we move out east towards Fort Lupton. And there's actually an inventory that's taken place as of last year of unused state properties. And so that inventory was actually already being taken last year, starting last year. So all of those are being put on the table. Obviously, if anyone has expertise or knowledge on this and wants to reach out to me or to the State Office of Emergency Management, the Department of Public Safety, feel free. I think, good ideas are always on the table. I don't think we're at that point yet. I know we're not at that point yet, but as we saw, we've got to get ahead of the curve, not behind it.
Okay.
Jonathan, you might reiterate the answer Daryl gave you yesterday about using the Broadway hospital campus and trying to occupy.
Yeah, no, and actually Daryl gave a great answer. I know he had to take off, and I've got about 7 more minutes before my next thing. But Boulder Community Hospital, there have been a lot of people asking, can we just use the old campus? There's a good possibility that the building has been pretty well gutted at this point and would be very hard to set up again in terms of everything from oxygenators to copper tubing to whatever might be in place. There could be some real safety risks to actually using that location right now, as much as it seems like the first logical step to go. And so, they definitely had a cautionary word out there to not use that location, at least at this point, knowing what we know.
May I ask a question?
Yeah, sure. Go ahead, Gene.
Yeah. As we go through this and I hear the word vaccine used, it comes across as if this is going to be the all wonderful thing. And as we know, vaccine we need, but they're never 100% preventative, or seldom, and they aren't with influenza. And so we need to keep that in mind. And we do not have any medical treatment yet for the condition. There is a study that is out there that seems to have maybe some credibility on the use of hydroxychloroquine in conjunction with azithromycin. And you may look into that. It does show some hopefulness for if we're looking for hope. And I don't think it's necessarily a fake thing. And I would encourage those to look at that and evaluate it. So that's all I wanted to say right now.
I'll just, since it's hit the regular news already, I'll just say a little bit more about that. Chloroquine and hydroxychloroquine are old drugs that have been around, I think, since the 30s for malaria primarily, and relatively safe and few side effects. And there is some evidence that there may be some value in that, but there's no really good studies yet to show that it's an intervention everybody should try. But I think they're going to be doing some clinical trials almost immediately because it does seem to have some value. The other thing I would say add to that is there's some in vitro studies that show that it helps, that with chloroquine or hydroxychloroquine, you can actually improve the cellular migration of zinc, which also may have some protective effect. But again, those are very, very preliminary and not ready for prime time yet. Gene?
Yes, if I could, there is the study, I picked up on it and I need to look into it further. It's from a neurosurgery colleague of mine in Denver, showing that there is a, in relationship to placebo, I don't know the numbers of cases, the use of hydroxychloroquine alone is partially effective. The combination with azithromycin takes it down to a significant improvement in a number of people within 5 days. And that's all I can say. And it's caught my eye. I plan to look into it further.
Yeah, and of course, azithromycin is a standard antibiotic used for pneumonia. And so if there is a secondary bacterial cause, that could be the reason for that particular factor contributing. But
I want to just add, I'm working with the ethics committee at Denver Health Medical Center at the present time and trying to gear up and face the onslaught of this. And they're kind of overwhelmed right now, and they're still waiting for that. So I'll be willing to help anybody out in the future.
great, thank you.
Thank you, Gene, and thank you again to our panelists and to the 41 of you who remain online here, demonstrating a great deal of interest. I'm sure that any of the panelists will remain open to your emailed or texted questions. So best wishes to everyone and have a great weekend.